Hello there, welcome to another episode of the She Health series. My name is Dr. Sida Ikanem, and this is my social impact project under the auspices of Excellence in Medicine Ladies Network and Medical Women Association of Nigeria Lagos chapter. So, in this video today, we're going to be talking about toilet infections. If you ever had symptoms you would describe as toilet infections, then you need to watch this video. It may just blow your mind. If you want to know more, then stick around. All right, thank you for sticking around. Toilet infections. Now, this is a very important term in my context as a Nigerian trained medical doctor who have had patients report their symptoms as toilet infections. Now, let me shock you. There's no such thing as toilet infections. Yes, I said it. Toilet infections does not exist as a medical term. However, the symptoms, usually a group of symptoms usually referred to as toilet infections, could mean two possible group of disease or group of infections. And in this video, I'm going to be talking about one. The first one is urinary tract infections. Now, what are urinary tract infections? Urinary tract infections simply means that bacterial organisms have found their way into the urinary system. Now, the urinary system consists of the kidneys, the ureters. Those are the tubes linking the kidneys to the urinary bladder, and as well the urethra. That is the opening where urine leaves the body. Now, this is the urinary system. So, whenever bacterial organisms find their way in through the urinary system, they cause inflammation, irritation, and infection, which produce a couple of symptoms I'm going to be talking about now. Now, for urinary tract infections, the symptoms include painful urination. You find out that when you're having or when you have to urinate, you feel a burning sensation, usually in your lower abdomen. That is a sign that you could be having urinary tract infections. Other symptoms of urinary tract infections include urge to urinate, the strong urge to urinate despite having very little urine in your bladder, which we usually call urgency medically in medical terms. Also, very frequent urination. Usually you find that one has to use the restroom or urinate more often than usual. Also, there could be lower abdominal pain and back pain depending on the extent of the infection. Usually, if this urinary infection has involved the kidneys, it will be normal to experience low back pain, okay, usually radiating all the way down to the private area. Then also, people complain of having very foul smelling urine or very abnormal colored looking urine. This could also be a symptom of urinary tract infection. So you can now see why people call this um, group of symptoms toilet infections, because they actually would suggest that these problems are encountered when they have to use the toilet by urination or through urination. Okay, but like I've already said, there's no such thing as a toilet infection. It could may as well be a urinary tract infection. Now, why do people have urinary tract infections? First of all, it will interest you to know that 1 in 2 women will have urinary tract infections in their lifetime. So you can see it's very common, and most people are embarrassed to talk about it. So why do most people come down with? Why do we come down, or most women come down with urinary tract infection? The first reason is simple. It's just the female anatomy. The anus and the urethra are very close and in close proximity to each other, right? And it means that bacteria from the anus can find its way up through the urethra into the bladder and cause infection. So this is the reason why women are more prone to have a urinary tract infection. But this does not mean that urinary tract infections cannot happen in men as well. Another risk factor for urinary tract infections is for people that hold their urine for too long. Okay, because holding urine for too long can encourage the overgrowth of bacteria. So it's always advised to empty your bowel as often as you can. And also, people who do not take enough water. Water is so important. It helps the kidneys to function better. Also helps with flushing out, bacteria that may have found its way from the anus to the urethra. So it's very important that you stay hydrated so that your kidneys can make as much urine as it can, and it just keeps your body in normal balance. Another thing, for people that have chronic infections like diabetes or kidney stones, they are more prone to coming down with urinary tract infection, because in terms of diabetes, their immune system is low, and it means their immunity is low, and it means they are more prone to come down with infections generally, and urinary tract infection is just one of the many possibilities of infections that diabetics could experience. Now, another thing is hygiene. Because of the way the female anatomy is designed, it is best that when a woman uses the restroom and she's cleaning up, it's important that she cleans in the right, using the right technique. This is the right technique. It is advised that after you use the restroom or anytime you have to use the toilet, make sure you clean from the front to the back and not the back to the front. I'm going to repeat that again. So after you use the toilet, make sure that you wipe from the front to the back and not the back to the front. Now, if one wipes from the back to the front, it's simple. You are carrying bacteria from the anal region where feces should normally, be excreted from the body. You're carrying those organisms all the way from the anal region to where the urethra is, and this can be a risk factor why women will come down with urinary tract infection, because you're just transferring or transporting bacteria that has no business being around the urethral region. Okay, another risk factor for another risk factor for urinary tract infections is poor hygiene. Just poor hygiene, that's the private area is not kept properly clean. It's not washed with mouth soap and water as it should. These are the things that could just hands down lead to urinary tract infections. So you can see from everything I've mentioned, I have not mentioned using public toilets as a risk factor for urinary tract infections. You see, because that is one thing people attribute or accrue to being a cause of urinary tract infection, but it does not come to play in this scenario. So what do you do, and what can you do to prevent urinary tract infections? It's really simple. Let's address the risk factors. Okay, I talked about hygiene. Very important. If you're hygienic, you keep your private area as clean as possible, wipe using the right technique, then it will reduce your chances of coming down with urinary tract infections. Number two, you want to stay hydrated. Make sure you drink a lot of water. Encourage your kidneys. This will encourage your kidneys to produce urine, and it will wash away and wash off bacteria that want to find its way up the urinary tract. The next thing you want to do Next thing you want to do to prevent urinary tract infections is to make sure you empty your bladder as often as possible, because holding urine can encourage the overgrowth of bacteria, and this can lead to urinary tract infections. The fourth thing, for those that have diabetes or other chronic infections that could predispose to urinary tract infections, it's important for diabetics to make sure that their sugar levels are under control, and they will do this by good eating, exercise, and regularly taking their medications. All right, so how are urinary tract infections treated? They are treated after confirmation of the diagnosis. Usually, a urine sample will be tested in the lab, and when this is done, it can reveal growth of bacteria. When that has been confirmed, then antibiotics can be prescribed easily to treat these infections. But like I always say, it's always best if you have such symptoms, make sure you report them to your doctor, who would know the exact antibiotics to prescribe to you. Please, I do not encourage self-medication, buying medications over the counter. Okay, make sure you always have a consultation with your doctor. This could even help you, because your doctor, even though you have a complaint, as it were, from his physical examination, he can pick out something of importance that you may have overlooked or considered not important. All right, so I have come to the end of this video. So this is the end of this video. Now, let me say this again. There's no such thing as toilet infections. Now, symptoms usually described as toilet infections could mean one of two things, and the first is urinary tract infections, and the second one is sexually transmitted infections. So, in my next video, I'm going to be addressing sexually transmitted infections as I'll be addressing treating sexually transmitted infections as one other group of infections or diseases people usually describe with the term toilet infections. If you've enjoyed this video, I want you to leave a thumbs up, drop a comment, share this video to someone, and they'll be glad that you did. And I'll see you again next week for another exciting time. Take care and Dr. Cedar cares. Bye bye.